the Group Chief Financial Officer at Narayana Health, who's joining us on the show. Sandhya, hi, good morning. Help us understand, how do you view the government's comprehensive CGHS rate revision? How significant is this move for the private healthcare sector?
I think I should first start with a little bit of an understanding of what has come through. The CGHS rates had not been revised since 2014. So there has been a long-standing continuous engagement with the government in terms of relooking at the rates, and this is the outcome of that engagement. If you specifically see in some areas, like say for example cardiac surgery or say knee replacement, some lab tests, etc., we've seen like really reasonable increases, about 50% to 25% kind of increases. But if you look at other areas, say maybe general surgery, maybe cardiology, procedures like angioplasty, or areas which are very frequently used like bed charges or high throughput investigations like X-ray, etc., there is hardly any increase or no increase at all. On OPD consultations, there is no increase. So if you look at imbalance, and I'm giving the numbers more as a back of the envelope, we are still working through the details to be able to have a more accurate view of what the numbers are going to be. But at the back of the envelope, if we see overall, the increase is not going to be more than 5 to 10% for hospitals. So maybe more in the range of 8%. In that range is what we are expecting this overall increase to be. So typically, when we look at CGHS, it is not just what CGHS pays us, but there are also other organizations like certain public sector, ECHS, etc., who also base their rates based on the CGHS rate. So if you take that into consideration, then in all, for most hospitals, anywhere between 5 to 10% hours, maybe in the range of 10%, it will be the contribution of CGHS. And in that, if we are saying in the best case scenario, maybe 8-10% of improvement, so that's the revenue improvement, if at all, we will see. So I don't think we will see a material number change per se for the hospitals, but definitely it's a positive trend, positive movement, and should help ease out a little bit of the burden on the cost of delivering the treatment.
Okay, Sandhya, thanks for that explanation. But for a hospital network like yours, right, which has presence across Tier 2 and Tier 3 cities, does the new city-based and NABH-linked rate structure make economic sense in a model like yours?
All our facilities are NABH accredited. We are in fact a JCI enterprise organization. And other than our flagships, all our other facilities are in flagship and the Delhi units. Rest are all in Tier 2 and Tier 3 units only. So there are two factors at play here. One is that the cost is on the higher side in Tier 1 cities, mainly on the manpower cost side. About 40 to 45% of the cost for healthcare goes into manpower. So to that extent, having a slight higher payout for Tier 1 cities helps, because it helps offset the costs to some extent. The other aspect is the cost of quality. It is very important that quality is differentiated, because there is a huge infrastructure cost and enablement that we have invested in, and most hospitals have invested in, to be able to be certified by NABH or JCI. And this also ensures that there is better quality procedures and better quality outcomes to the patient. But the bigger benefit on this will be, because NABH and other certifications are incentivized, therefore, a large number of hospitals who have historically not chosen to do NABH, smaller Tier 2, Tier 3 hospitals, they will come forward to go for the certification, and therefore the overall quality of healthcare in the country will improve. So that way, this is a very positive differentiation.
Okay, positive on that front. But Sandhya, let's talk financials. What could be the impact on your margins? Do you see this move improving your margins, or will the benefit primarily come through better cash flows and faster payments?
Substantial impact on the margins will not be seen because of this move. Also on the cash flow front, I think we will have to get paid on time. So one of the challenges which we have with most of the government schemes is the timeliness of payment. So if we actually factor the cost of the locked up working capital, already we don't make money on schemes, but it actually goes deeply negative if you see our internal math. So while the change is a welcome measure, we would also expect that a more robust, timely payment infrastructure is put in place to make it more workable for hospitals.
Okay, so no material impact on margins is the sense, Sandhya, but how does this rate hike compare to the industry's expectations? Is it sufficient to make the CGHS participation financially viable?
So if you look at how far health costs have come from 2014 to now, we all ourselves know this is a data that you well researched and published. It has gone up multifold. So even let's assume that where we have taken a 50% increase, where we have been given a 50% increase, it will still not offset the cost of inflationary increase that the sector has seen. What's typically happening in the industry is that the cash patients are cross-subsidizing for the low-paying scheme patients. And if you look at cash patients in our country, just because someone pays in cash does not mean they have means. In fact, it's the other way around. People who have means typically have insurance. People who pay by cash are people who don't come from backgrounds where they can afford an insurance, and then the healthcare event becomes a very life-altering event for them. It crumbles their financial position. So it is these patients who actually are ending up cross-subsidizing the poor-paying government schemes. So therefore, it is very important that the fact of inflationary pressure, the fact of where the market rate is, and the fact that hospitals need to be compensated reasonably for the work and the cost that is being incurred has to be taken into account. So we are definitely very appreciative of the fact that a measure has been taken to increase the price, but it is still very moderate and significantly subsidized to our hospital realizations.
Right, okay. And Sandhya, lastly, do you expect more hospitals to rejoin or participate in the CGHS after this revision?
I'm not sure whether the patient footfall is variable to the price at which the government reimburses us. But then what we definitely expect is that with the revised prices, more hospitals may come forward to empanel, to certify themselves to better quality standards, and therefore there will be a broader spectrum of care availability for CGHS patients, which will be a positive development.
Okay, Sandhya, appreciate you joining us, and thanks so much for your time and the impact that you've explained so beautifully of the CGHS rejig coming in on your hospitals. Well, that was Sandhya Jay talking to us from Narayana Health, and that's